Good afternoon. Thanks for joining us across the fence. I'm Fran Stoddard. Our focus this afternoon is on the chronic disease asthma. Asthma is a serious illness in which the lungs become inflamed and the airways narrow. In a state that boasts fresh, clean air, it turns out that Vermont suffers from one of the highest asthma rates in the country. According to the Vermont Department of Health, about 67,000 Vermonters have asthma. To learn more about asthma, what causes it, and its treatment, we've called on specialists from the Rutland Regional Medical Center. Sarah Cosgrove is a certified asthma educator and licensed respiratory therapist. Sarah's professional credentials also include certification as a tobacco treatment specialist. So, Sarah, it's great to have you here, and you are certainly the right person to talk about asthma. Thank you so much for joining us.
Thank you for having me.
So, again, what is asthma and what causes it?
So, asthma is what we call a chronic disease, and that's something that you're going to have your whole life. And some of us are born genetically disposed, so maybe someone else in the family has asthma, or early on we were exposed to large amounts of what we're going to call triggers. So, when we're exposed to what we call triggers, some of us that are more sensitive have more sensitive airways, which are carrying the oxygen in and out of our lungs. Those airways become swollen. And when they become swollen, it actually tightens up the airway hole. So it's smaller, you're getting less oxygen. Another piece of asthma is those airways that are swollen and already have small, the small airway passage has little muscles around it that tighten right up, making the airway even smaller. And when these airways tighten up, so they're much smaller, less air is getting through, it actually puts mucus in your lungs too. So for people that have asthma, that cough and that need to clear their throat, the is actually a sign that those airways are tightened up and full of mucus. So we have a little tiny airway now, you're getting less oxygen to your body, and the body runs on oxygen, so you can't function as well as you can. You're not breathing well, and it affects everyday life.
Oh. So asthma also, it occurs in children and adults. Is childhood asthma the same as adult asthma?
Well, first of all, asthma doesn't go away. It's something that you're going to have your whole life if you have it when you're a child. And usually where we see the most cases of asthma are early on, when someone's a child, or late in life. And that is because, obviously early on you don't know what your triggers are, you don't have medication, and you're figuring it out. And later on in life, it's because, you've become lax or perhaps, more triggers along the way. So asthma doesn't go away. You have it your whole life, but in the middle part of your life, usually we've identified triggers to stay away from. You're on medications and you're using them properly, and you're able to communicate properly with your physician. And that's one of the most important things, is having that communication with your physician.
So you're able to manage it better. So let's assume that somebody has symptoms and they've gone to their primary care provider.
Yes.
They're diagnosed with asthma. What's next?
Usually, a pulmonary function test. Let's find out what your severity of asthma is. So that's going to a specialist and them doing breathing tests on you. But also screening, how many times are you waking up at night with symptoms? How often are you short of breath? Are you short of breath with activity? Once again, are you sleeping at night? Because a lot of symptoms occur at night. So by able to answer these questions, you're able to assess the severity, which then puts you on the proper medication and management plan. And asthma lives in two worlds. You've got the controlled world, where a person with asthma can live every day barely, having any symptoms whatsoever. And then you have the uncontrolled world, where people are having difficulty breathing, that shortness of breath, the chest pain, that tickle in the back of the throat cough, but it's not that hard with proper medication and learning what triggers or sets off your asthma to get that uncontrolled world to controlled, where you barely know you have symptoms.
Well, we certainly, many of us see people with inhalers that help. Is that the best or only treatment for asthma?
It's not, but properly using your inhaler makes a world of difference. We highly suggest using something called a spacer, which is a little tube that your inhaler attaches to. So when you're not taking your inhaler properly and you're just putting it directly to your mouth without this spacer, the medication shoots out. I believe they say like 30 miles per hour. And your airways are very wet and moist. So that medication actually sticks to the upper airway and doesn't get down into your lungs. By putting that spacer in there, it allows the medication to slow down, first of all, that you can take it in with your breath all the way down into your lungs, but you get less of that medication sticking on the back of your throat, which can cause the pounding of the chest that people don't like, the anxiety piece of it. We want it to get to your lungs so you're not having that effect of the medication.
That's really good information. And
Important.
once someone has been prescribed an asthma medication, does
Yeah.
that mean that essentially they're cured or can manage it fine?
You're never going to be cured. That word scares me. You're learning to control your asthma. So we have quick relief medications, or what we call rescue medications, that open the airways up so you can get that breathing in within like 5 to 15 minutes. You can feel that relief, and that's very important to have on hand. Keeps the airways open so you can get your controller medication. And a lot of people have controller medication, which works on that inflammation of the airways and makes those muscles less around the airways less twitchy, so they don't want to tighten up as much. So it's very important, even when you're not having symptoms, to take your medication as prescribed, because if you're not having symptoms, guess what? The medication's working. Keep
Working.
going.
So what are consequences of not getting treatment for asthma?
Well, we can head in a very bad so when you see people that can't walk very far, they're huffing and puffing, people that can't participate in activity, that's telling us that your asthma's not controlled, and it's really important to get it back in control because of lifestyle. You want to have a good quality of life and to be able to have a good lifestyle. What was the first part of that question?
Well, it's what happens if they aren't using their medicine,
So,
or not getting treatment of some sort. I mean, that's
very
so scary.
dangerous.
I'm feeling tight in the chest just talking about it.
Rescue inhaler. It's scary because yes, asthma, the tightening of airways can prevent you from getting oxygen to your body, and if you do not get oxygen to your body, that's detrimental. People that continue to have asthma attacks, you can actually have more or less a scarring of the airways. So medications don't work as effectively, and this can eventually lead to COPD, which is the chronic obstructive pulmonary disease, where you don't get relief from medications. You continuously live in that world of shortness of breath.
Yeah, scary. So let's talk about some of these specific triggers. You talk a lot about triggers for asthma.
Number one trigger is being around smoking or vaping, or living in a household with. So we send a lot of people to 802quits.org. Great resource to get you started to, quit smoking, get you on that path. Allergens, pollens. We live in the great state of Vermont, and we're very fortunate to have all this wild life and foliage around us. But if you're sensitive to that, definitely pollens in the air effect. Changes in weather. We're going to be going through one of those very shortly right now. That change from really, really humid to cold weather, or even thunderstorms. Just enough of that change, even in humidity, can trigger asthma.
Interesting.
A lot of people don't like it, but pets.
Pets.
And there really is no asthma friendly pet, but one of the first steps we say, keep them out of your bed in your bedroom. It's not necessarily the hair, which is a huge piece, but it's the dander. It's the saliva when they lick themselves and clean themselves. So when you're sold an asthma friendly pet, I think a lot of it is the cell. I don't ever want to say get rid of your pets, but keep them out of the bedrooms, keep them out of the, keep them out of the living areas where you're spending your time, and pay attention to, carpeting. That's a big one. Carpets collect so much dust, dirt, dander, everything. So removing carpets is very important.
So just remove them. Okay.
I say remove them, vacuum frequently if you have throw rugs, and don't wear shoes in the house. That's another huge piece there. Another one too for the little ones is the amount of stuffed animals on beds.
Oh, great
Yes.
thought, of course. Right.
You've got that good old teddy bear that you've had forever, that they sleep with at night, or even, amount of pillows.
Yeah.
It all contains dust, and that exposure at nighttime can definitely trigger asthma symptoms.
So, clearly, smoking is such a key trigger, as you pointed out. What's the first step that you recommend for somebody who wants to get tobacco out of their life?
I would say call your doctor. I mean, it's one of the most important things you can do for your health. Tell them that this is something that you're pursuing, because there are medications out there that can make this much easier. 802quits.org is a great resource. They can provide those medications free of cost or at a very reduced cost, and those are called nicotine replacement products. One of the biggest things that sends people back to smoking when they're trying to quit are those nicotine withdrawals, feeling awful. So this nicotine replacement, which is in the form of the patch, gum, or lozenge, acts as like a Band-Aid. So you're not feeling as awful when you're going through the process, so you can really work on those little behavior changes, being able to not go out to where you usually went during a cigarette break, recognizing those connections, talking on the phone and cigarettes. You can work on living without cigarettes.
Okay. And exercise is important, but not too much. We're just about out of time. So a common myth you want to tell people, and is exercise okay?
Exercise is very, very important. And if you've got your medications on board, you shouldn't be having any symptoms, but also having that rescue inhaler with you. It opens up that airway. So if you're out there playing sports, 15 minutes before you go for sports or 15 minutes before you go out for that walk, take that rescue inhaler so it has time to open up those airways, and you'll be able to.
You'll be okay.
You'll
Sarah,
be fine.
I'm sorry, we're out of time. Thank you so much for joining us and explaining some very important things about asthma.
Thank you.
And thank you for joining us across the fence. I'm Fran Stoddard. Stay well.